Hello everyone. Hello to the whole Pasteur Network community, and welcome to this new edition of the Pasteur Network monthly seminar. I am Hichem, your host and the coordinator of these seminars. Today's session is special because it's the final seminar of the season. On behalf of the whole Pasteur Network team, I want to thank you for being with us throughout the year. There will be no seminar in August, but we'll be back in September. And at the end of the seminar, we'll share a short survey to get your feedback on this past season and gather ideas for the next one. I'm really relying on you to improve and tailor the sessions to your interests. As always, we will start with our guest presentation, followed by a Q&A. So feel free to drop your questions in the chat or anytime during the Q&A. And please keep your microphone and camera off during the talk so we can keep everything running smoothly. To conclude this season, we are really pleased to turn our attention to a timely forward-looking topic. One Sustainable Health Forum together for a healthy planet and healthy life. And for that, we have the pleasure to welcome our speaker, Benoît Miribel. Benoît Miribel is the president of One Sustainable Health for All Foundation, launched during the COVID-19 lockdown. The foundation coordinates the OEGH Forum and the One Europe for Global Health Coalition. He is a member of France Economic, Social and Environmental Council and chaired the French Foundation Center from 2015 to 2022. He also served as the Director for Global Health at Institut Mérieux and the Director General of Fondation Mérieux, supporting the fight against infectious diseases in low-resource settings. He is also honorary chairman and of Action Against Hunger and has served on the boards of the European Foundation Center and Voice, the European Humanitarian NGO Network. Benoît also co-founded the Journal of Humanitarian Alternative. He also chairs Earth Week, focused on plastic recycling, and sits on the board of Friendship in Bangladesh. He's also active in the think tank Santé Mondiale 2030 and Resources. His past advisory roles include the High Council for International Cooperation, the White Paper Commission of France's Ministry of Foreign Affairs, and the National Commission on Human Rights. Okay then, so Benoît, the floor is yours, and we'll return after the presentation to moderate the Q&A session. Thank you very much. You can share your screen.
Yeah, thanks a lot for the introduction. And it's a real pleasure to say hello to some friends that I know from Pasteur networks, some of them for years. So hello to everybody, and thank you for the invitation. It's true that it is the occasion to give you or to remind you, because some of you were attending the meeting in Tunis, where I was also introducing about what does this forum, the One Sustainable Health Forum, and also coming from the forum, the One Europe for Global Health Coalition. So I am not alone today. I have with me Juan Ubroth, who is the scientific coordinator of the foundation, because to support the OEGH Forum in 2020, we had to create a foundation, which is a tool to support the OEGH Forum. So I will leave the floor after this presentation to also Brian Redkin, who is the coordinator, the lead of the OEGH Forum and the strategic initiatives that come from the OEGH Forum, such as One Europe for Global Health Coalition, and also the project of OEGH Institute Network. Just to remind you now a few words about what we do. It's true that if you look to the picture that we had for our first annual event, the first annual event of the forum, the OEGH Forum was launched in 2021 to formalize the discussion coming from various experts. and it was a decision to try to go from informal discussion to formal discussion through international working groups. So you see the image, and somehow I would say that this forum, one of the main goal is to bring together the professionals of different communities, and especially those who are coming from climate, biodiversities, and those who are coming, I used to say, from the traditional One Health, zoonoses, etc. So, and we know that we need to scale up our impact and how. And last year, we moved after 3 years with the Boulocain Foundation in Lyon, where we started. We have been invited by Yasmin Belkaïd, by Pasteur Network, all together to join Pasteur. And it was a recognition somehow of what we were doing. And some of you who know the story since the beginning are involved. And I thank all of you for that. And the main reason was from science to society, together to scale up our capacity, our impact. So the OEGH forum was launched with the commitment of the World Health Summit, especially with a strong involvement initially from Professor Detlef Ganten, who is the founder of the World Health Summit and the Dean of the Charité, and also Antoine Flao from Geneva Health Forum. Together, they were really in favor of seeing this kind of virtual new kind of forum. And we have our two friends, the main forum in Europe, Geneva and Berlin, with us, since the beginning, and this is very important. So we have currently 10 international working groups, and Brian will give you with one more details about it, and about 150 member organizations. And various experts from more than 30 countries. And so you have some persons that you know, and some are from Pasteur Network with a great commitment. And so we have, the different logos of the organization, and we have a balance between on one side, the international working groups, where the experts need to speak freely without having the reference. It's not an obligation to the organization. It's a kind of Chatham House discussion. And then the organization that are the member of the OEGH Forum to endorse the recommendation coming from the international working group. So after the launching of this forum in April 2021, with messages from FAO, from Tedros, WHO, and many experts, we started with this with 6 international working groups, and we were able to release this report about what was coming from the 6 international working groups. And I'm sure that Juan Lubroth, he will introduce himself, but Juan was in charge at FAO of all the animal policies, among other activities. He will tell you more about that. But at the end, what was really coming for 4 main recommendations was about public knowledge, finance, data, and scientific evidence, and strategy and governance. And this is now, you can go on the website and you can have it in English or in French, and it's about 60 or 70 pages. That was the start of this community. And again, the forum is not implementing, it's just organizing common discussion about the issues, and the choice of having one sustainable health come from the facts and the need to have together the planetary health community with the One Health community and with the OEGHs expert also, as you know. So we bring together this in the kitchen, and we work on that. So we have been also asked to launch during the French presidency of EU a network. We were encouraged for that, and it gives us the possibility to explain in February 2022 in front of the European Health Minister to explain in a few minutes about the challenges of one sustainable health, not only One Health and planetary health together. And Brian will tell you more because now we follow this initiative with a session every 6 months in the country chairing Europe. And we have now currently 10 in international working groups. And maybe I will leave Juan and Brian at this stage to comment these international working groups, and maybe to open new slide, and I will come back in the main presentation.
Brian, would you like to introduce the international working groups?
Say that again.
If you would like to introduce the 10 international working groups.
You would, I can't hear you, I'm sorry. Juan, you're going to do this, right?
Yeah, maybe I suggest, Juan, you can, I have still the slide, you can explain the meaning of this international working group. In the meantime, Brian is preparing the slides, and he will show the slides.
Everything's ready. It's just I want everything's ready. I just want Juan to take the lead.
I'll jump in.
Introduce yourself, Juan, first.
Yes, thank you, Benoit. Thank you, Brian. I'm Juan Lubroth. I'm a biologist, veterinarian. I did my PhD in epidemiology and public health, and in my past. I've been in a laboratory setting as a researcher, a diagnostician, but also a lot of field work in disease management, wildlife, livestock, and then of course in public health. At FAO, where I joined in 2002, I was the head of infectious diseases, and then became the chief veterinary officer for the United Nations, for FAO. And I was the coordinator for antimicrobial resistance for the organization that included food safety, plant, crops, animal, water, soil. So it really brought in a lot of aspects that you are all familiar with in addressing antimicrobial resistance and community outreach to improve biosecurity, vaccination schedules, so that you would not need to rely on these life-saving medicines. So I retired from FAO in 2020, and I joined the One Sustainable Health work with Benoit as the scientific coordinator for the Scientific Council. So the international working groups is a very exciting effort. There are 10 working groups, and you can see them listed there on the slide. One of the exciting ones are certainly the next generation preparing, which is number 8, those young professionals that want to learn from older people like myself, and actually not repeat the same mistakes that we or our parents or our grandparents made if we're talking about One Health and planetary health. From a scientific point of view, you are familiar, I hope, with the One Health concept overall, and the image of these 3 circles of animal health, human health, and environment or ecosystem health that overlap. It is something that does not sit right with me, because humans are terrestrial mammals themselves. So to separate this type of medicine, veterinary or human medicine, is not quite settling, does not make biological sense. And to have that overlap with the environment, we all live in an ecosystem, in an environment. And I prefer the term environment rather than ecosystem, because environment may also bring in concepts of where you are in social status, level of education, level of nutrition, urban versus rural, and not necessarily ecosystem in that abiotic atmosphere. But with the international working groups, we have two or three co-chairs, and they kind of lead a group of.
Juan, can you hear
Go
me?
ahead. Yes, I can.
Are you changing the slides? Because we're still on the slide 6.
No, that's still
Okay.
fine. I was just I was
Okay. You're
I was
staying on the
combining.
same slide.
But
Yes, I was
I'm doing
combining my philosophy with the international working groups and how we are functioning.
Go ahead. Sorry.
Okay.
Okay, go ahead.
No,
Okay,
that's all
thanks.
right. Can you expand that slide? Who's ever under control? Maybe it's you, Brian.
Benoit, can you put? Yeah, thanks a lot.
There you go. That's it. Yes. So the international working groups, which we don't want to create 10 different silos, we do have a convergence group that you see in the center wheel. And this is to ensure, well, commonality of purpose, of design, and for example, with education and communication, well, that affects all the other 9 working groups. If we're talking about governance, well, that for certain as well. So that convergence group meets to discuss common issues between the international working groups and look for bridges of their work. And even if they have a project or writing a policy paper, that they would be able to share it with the other working groups, and other working groups are able to contribute some thoughts and expand that knowledge. We do have a monthly information meeting with the foundation and its partners, and we invite one of the international working groups to give a 10-12-minute update of where their work is heading. So this is a very exciting, and it would be even more exciting if people from the Pasteur Institute network would consider joining one of these international working groups. After all, it is a forum, it represents civil society, and that is quite unique with this One Sustainable Health Forum. That's all for me. Brian, would you like to?
Yeah,
sorry. Would you like to discuss, Brian, on the slide, if you have it, or Benoit, how the international working groups address the Sustainable Development Goals?
Yes, I can do that.
Thank
Absolutely.
you, Brian.
And I would ask also, Juan, that you take the lead regarding the. Hang on, I have to make sure I open the right. I don't know if you're seeing a screen here.
Yes, we are.
Are you seeing a screen?
Yes, we can see it.
Okay, here we go.
If you can put it on slideshow, that will be great.
Is this visible?
Yes, it is.
Yeah, but you need to put it on slideshow, please.
Yeah, I will. Just want to make sure. So, Juan, before I go over there, what I'd like to do is, with regard to the IWGs, these are the different IWGs. I'm not going to redo what Juan has just done. I'm going to show you the way they work together and ask Juan to speak to that, if I may. The convergence group that Juan is the scientific coordinator of, and Anne-Françoise Berton, who has just joined us from ANSES, is the strategic director of. So, Juan, if you'd like to make some introduction here.
I think I already talked about the convergence group and making sure that we don't have 10 silos or common ground between activities that occur in one international working group with that of others. And so they reach out to each other, and the convergence group is a platform where that takes place.
Very good. Thank you. The Sustainable Development Goals. So my name is Brian Rudkin. Essentially, I'm young emeritus director of research at the CNRS, at the Stem Cell and Brain Research Lab at the University of Lyon, INSERM. And the activity of research that I've been doing for my career has been on molecular and cellular neurobiology and related cancers, signal transduction, etc. So I'm perfectly suited for this work, as you can imagine. I've known Benoit for a number of years, I think since the 80s. And essentially, he asked me if I could help out as of 2020. And I finally agreed in 2021 to assist initially with what you see above me, the One Europe for Global Health Coalition, and now taking on the the lead for the OSH Forum and strategic initiatives with a team that Benoit has generously put at my side. So one of the things Benoit has always said is that the international working groups should strive to address, if not accelerate, achievement of the UN Sustainable Development Goals that you see here on this slide. And recently, when I've took over the idea of trying to invigorate the international working groups, I asked Marie Dauphin, who is also assisting us, an intern, if she could take a look and see what the topics of the different international working groups are and how they correspond to the Sustainable Development Goals. And then we bounce this off of the different co-chairs. And here's the result. That was also reinforced by Savannah Faircloth, who is in our team as program manager for this kit and caboodle. And what you see, I'm not going, of course, into the detail, but what you see is the different international working groups and the different SDGs that they address. And if you have time, you can take a look because we will, of course, share these slides in the end. You can see that every single one of the Sustainable Development Goals is indeed addressed by the different international working groups, achieving the goal that Benoit had set right from the beginning. I'd like to add that the other aspect is that we be global. And I don't have to tell you, Pasteur Network, the importance of being global and the importance of feeling as if you are in a community. And that is like, I'd like to put in a plug here, thanking Rebecca and the Institut Pasteur for allowing this to happen. That is, that we be under their umbrella and able to collaborate with you because we feel there is significant synergies, as you'll see. This is a measles map, no pun intended, of the distribution of our experts over the world. And you can see we are, of course, very Eurocentric for the moment, and actually very much in France, but we do have people all around. Over 108 current IWG experts in 38 countries of 8 regions. What we do in the working groups is to understand, advise, and operationalize. In the One Europe for Global Health, in collaboration with the Virchow Foundation of Berlin, we essentially try to compile and communicate to policymakers, enterprise, finance, and civil society. We're actually saying that if we can educate or come up with messages that children in nursery school or even kindergarten could understand, we just might be able to influence policymakers and help them understand the impact. And I'm saying this tongue in cheek, but believe it or not, several of the politicians that we've said this to smile and say, you're absolutely right. And I borrowed this slide from Juan that I really love. It's, we share the love. And how do we do this? Well, in the context of the One Europe for Global Health Coalition, again, in collaboration with the Virchow Foundation, after the event that was organized in Lyon in 2022, where Benoit and Ole Peter Ottersen, the then president of the Karolinska Institute, presented in person to the ministers of health of the 27 member states. This took place in Grenoble. We decided to create this coalition of One Europe for Global Health to carry the word to the different member states with the rotating presidency of the Council of the European Union. And so, as you can see, with partners in each of the countries, we have gone to the Czech Republic, to Sweden. I don't know if you're aware, but this was actually done in Nobel Forum. That's the table, that round table, if you can see it, is where the Nobel Prizes are decided. IS Global, an excellent institute that you may know in Spain. I'm not sure if they're a member of the network. In KU Leuven, we had Peter Piot, who was the personal advisor to Ursula von der Leyen. So it's just to say that we are really listening to what the countries have to say, and we are sharing the messages that are carried on in order to increase the understanding and action in this regard. And as you can see, we've done all of these countries. The last one was Poland. We're preparing Denmark. And again, this is a very dynamic aspect of our work. What we've realized actually very early, since 2020, 2021, is that in order to make this happen in a much more effective manner, it would be astute, if not pertinent, to create a world network of One Sustainable Health Institutes. And that's what we have been doing. The idea is to create local and regional One Sustainable Health Institutes, or centers, in each region of the world to offer advice and guidance to civil society and government, to leverage commitment and support of existing public and private actors. There's no need to reinvent the wheel. This exists already. And to leverage initiatives in the regions, etc., to sensitize society and the benefits of how to, and the cost of inaction, which is significantly higher than actually doing preventive actions, to do it together. And what we realized, we've organized some events in the World Health Summit in Berlin in 2023, and first of all, with experts from around the world to try to understand, is this pertinent? The answer was yes. We then, in 2024, brought together people from several different parts of the world in order to discuss, and I think I may have made a mistake here in the slides, let me go here, to discuss the opportunity. So we've had Africa, Asia, Latin America, the Caribbean, North America, Europe, and beyond. And some of you may recognize Fiocruz, who has been a staunch supporter of this effort, along with Awa-Marie Kolsek in Africa, Keith Martin, the Consortium of Universities of Global Health in the United States, Su Yongguan, who is in the Research Center for Eco-Environmental Sciences of the CAS in Beijing. It's a huge dynamic. And in the week leading up to the inauguration of the World Health Academy, WHO Academy in Lyon, we were able to have an event where we presented a sixth entity, which is the St. Joseph's University in Beirut, which was very particular because they are able to implement and organize actions around One Sustainable Health in the absence of any government, is the way they put it, which I perfectly understand, and in a situation of, let us say, quasi-total chaos. So much is to be learned from them. And more recently, we are bringing on people from the India Institute of Science and the Institute for Biosocial Research of India to do the seventh. We only have one region left, and that is Oceania. But as you can see, they have all agreed to perform preparatory conferences leading up to the event in November, and to come back with the position of the regional actors in order to start the ball rolling. And I believe that's about it. No, this is my last slide. It's essentially to say the World Network of One Sustainable Health Institutes, it's realistic, it's feasible. Why? Because we're doing it already. And we're bringing people of like mindset together for a common goal. And here's where I say, I hope you realize the interest and the importance of us integrating the Pasteur family as this effort that you have been doing over many, many years. I think we have a lot to learn from you. And we are opening the doors, saying, if there are any experts out there who'd like to participate in the international working groups or in the conception of the institutes in the various regions of the world that we have identified, we are more than happy to work with you. Again, the idea is to do training and education, stimulate innovation and research, intelligence and surveillance. We have to have accountability and metrics, and try to permeate all levels of governance from local to global. And in that way, we hope we'll get everybody to row in the same direction. Thank you. I'm trying to stop sharing. There we go.
Thank you, Brian. So I'm going to follow with a few information about the annual events that the OSH Forum is organizing. We started in July 2023, again, with the main purpose of bringing together, again, the planetary health with the One Health families. together focusing on SDGs. And so it was the case with tackling together our health, environmental, and social challenges. And then we were invited to do it in Dakar last year by Professor Awamari Kolsek and also Amadou Sall. So we were in Dakar, and we will be back in Lyon in November, early November. You know that now November 3rd is the One Health annual day. So at this occasion, we will have our annual events, and it will be together for healthy planet and healthy life. So it was a partner we had in 2023. They are already with us, and the image is not very clear for the moment. I'm sorry, but just to notice that it is from November the 2nd on Sunday and to November 5th in Lyon. It will be at the Research Cancer Institute, IARC, and WHO Academy, and other places, because we have a lot of requests for side events. The quadripartite will have side events, GIZ, and many other partners, of course, and we are able to organize it thanks to the support of a professional agency for that, GL Event. So we will have a scientific conference, but yesterday we were in a meeting, interministerial meeting at Élysée about this topic, especially because our Chief of State, Emmanuel Macron, decided to organize a presidential One Health at this occasion. It was supposed to be the afternoon of November 3rd, but it moved to November 4th. And so this is why the scientific conference will be not on the Sunday afternoon, but on the Monday. So we are going to update the agenda following this meeting that happened yesterday. And but the good news is that they decided to come to Lyon due to the fact that we are civil society, because we have many organizations, and again, our work is from science to society. We include any kind of public and private partner that is connected to this reality, and even small NGOs. And it will be the occasion concretely to explain for a city, for communities, how it works and why it is necessary to converge on these issues. So according to the timing, we are going to stop here, I think. So if you have any question now, we are open with Brian, Ron, and myself to answer. Maybe, Brian, I don't know if you have right now maybe the deliverables from the International Working Group. It's because we mentioned the teams, but sometimes we have questions about what should be delivered by the International Working Group. Maybe we can show at the screen. I'm going to show the policy brief, for example, that was done by International Working Group 9, just as an example. It is a policy brief, unless you have it, Brian, I don't know.
Yeah, it's not on my screen right now, no.
Okay, I can show it, I have it. So the International Working Group 9 is about One Health in humanitarian settings, and it is co-chaired by Geneva University and Belgium NGO, which is Humanity and Inclusion. And so you see, you have an example of the policy brief that was released in January, about the author, the contribution. So we can share it. So it explains, you may know Shadia from ROA. humanitarian action in the context of global environmental and health polycrisis. So again, the objective, one of the main goals of this work through the International Working Group and the Forum is to adapt the activities and also to influence about the policies, both private and public policies together. So this is just an example of what was released early this year from the International Working Group 9 with a call for action, concrete action, and also for more research. And I was asked to conclude this paper with a call for action. Okay, so it's just an example. Maybe, Brian, I don't know if you have you want to share additional information about the deliverables, unless we are going to
hang on. Yes, I certainly can. If you see my slide, again, the convergence group, as we said earlier, this is not made in a slide format, okay? But it's essentially, for the moment, it's a document that is in progress, where we have summarized for each of the international working groups their activity, their vision, their mission, the description of what they're doing, their objectives, and their deliverables, and sometimes the methodology. And overall, the way it works is we have asked each of the co-chairs to discuss with the members of the international working groups what they would like to do. We're not asking for the world, right? We're asking for focused actions, concrete examples with outcomes from each of the individual international working groups. And so that is what is summarized in this document for each of the international working groups. And I'm not going to go into the detail, as you can imagine, but just letting you know that this is the work in progress in this regard. I'd like to add, if I may, that, yes, we also have the list of the experts in each of the international working groups with their affiliation and their countries and area of expertise, the different topics. And we'd love to include those of you who feel inspired and motivated to contribute to this actively. Of course, November 3rd is a milestone, that is for sure, but we're not working just for November 3rd. Obviously, I want to make that perfectly clear. Our objective is to work together to try and come up with concrete examples that can then be transposed and increased in terms of degree of scale and scaling up of the different solutions. So that is the idea, and I'm sure that you are all very sensitive in a positive way to this. But again, I'm just showing you that we have a number of members, actually 108 from essentially the 38 different countries from around the world for the moment. So Benoit, is that sufficient, or would you like more?
Yeah, that's fine, because as agreed, we need to leave 15 minutes for the question. Reminding also that, as it was mentioned, this was developed thanks to the support of Pasteur Paris, Institut Pasteur Paris, and Pasteur Network together. I cannot name everyone since many persons are involved. And as you know, now we are under the umbrella of Pasteur Paris, working closely with Pasteur Paris and Pasteur Network, and there is still many spaces of collaboration open. We have also a monthly meeting of the forum every month. It's on the first Monday of the month at 3 p.m. CET. So it is open to any expert. And we were reviewing the international working groups, especially having this challenge at the end of the year with the Presidential One Health Summit, to be able to have clear messages. So again, it is open. This is the spirit of the forum. Now it is open for questions. Juan Ribros, Brian, and myself are already here to answer your question.
Thank you so much to everyone, to Benoit, to Juan, and to Brian. Thank you so much for your presentation. And it's clear that we have a lot of possibilities and avenues for collaboration between the network, the Pasteur Network, and OEGH. So we have 15 minutes for questions. So the Q&A is open. Who has a question? Noel, please.
Hello. So I'm sorry I didn't see all the slides when they were going, or it was not a lot of slide. First of all, I would like to say thank you to Benoit. We are friends since years, and for this initiative. My question was indeed, you know, that One Health has become very popular in the recent years. So whatever style of One Health it is, you mentioned support of ANSES, of FAO, of Institut Pasteur, of UCRUS. And I would like to know how your structure is fitting with the other event that exists in the domain, particularly, you know, the high-level group for One Health, which has been created by WHO, if I remember correctly, something like 3 years ago, with Thomas Mettenleiter at the beginning as the head, with now Wanda Markotter, and they are representative of the different countries. So how are you fitting with this group, and what is the interaction that you have? Thank you.
Yeah, thank you, Noel, and good to see you. And
Me too.
and you know the story since the beginning of this forum. Yes, among the members, among the founder of the forum, of the OEGH forum, there is Serge Morand, which is the French who is in the OLEP, One Health high-level expert panel, and OLEP is working with the quadripartite. I will. I see a slide showing this. And so the quadripartite, I met Emmanuel Soubiran yesterday in Paris with the cabinet, and they would like to have a session, a side event officially. But maybe Juan, you know more than me about that.
Well, I just wanted to address what Noel was saying. Some members of the OLEP, of the high level, which is quadripartite, not just WHO, are part of the international working groups. Benoit has also mentioned Serge, who is part of the scientific council for the foundation. So Natalia Sediel and Salome Cavachi, they're from Kenya and from Colombia, are part of this effort. So some ways, what the foundation representing civil society distinguishes this voice from what the OLEP is doing as advisory to the United Nations plus WOA, OMSA. So I think it is complementarity, and certainly we review what OLEP is proposing, or the quadripartite, and we're very close to the quadripartite. Over.
Okay, and so what is sorry, what I'm just continuing. So yes. Sorry,
if I
let's
may
go.
add. Yeah. It's the quadripartite has just created a community of practice in governance for One Health, of which we are participants. Several of the people in our group are participants, such as Ole Peter Ottersen, who just presented to them a few weeks ago. They're very enthusiastic, apparently, about what we are doing. In answer to your question, they're actually wanting to work more closely with us. We had some discussions with them in this regard in order to accelerate their actions as well. And so that's with regard to the quadripartite. Another entity that you may be familiar with is the PRISOD. And Juan, if you'd like to mention, because you're in the steering committee.
Yes, well, PRISOD is a partner of the foundation, and I serve on their scientific advisor group. Thierry Lefrançois is part of our group, so I think there's bridges there that we build on, and hopefully, as Brian has shared, we're rowing in the same direction.
And so you are, if I can continue, you are, so if I understand, if we are comparing OLEP, which is more quadripartite, if we are comparing with PRISOD, for example, which is a research program, And you are more, let's say, socially oriented to society. So how are you doing to take the temperature of the society? I'm more talking about Africa, for example, where I am, and when the society is not that easy to be simply reached. How are you doing that?
In fact, we have for Africa our Marie Colsec from Senegal, who will lead the delegation, African delegation, to come to Lyon. She is really committed in what we are doing. And it's true that we welcome any kind of organization in the forum for the discussion. You know, this is so very, as you said, a social and systemic approach about that. For example, during the event in Lyon this year, on Sunday afternoon, we will be at the City Hall of Lyon with citizens. It will be a booth between professional and citizens to discuss about the daily, about the pollutions, about what is, what makes the difference in our life in terms of practices. And so everything comes from science. And this is the initial commitment of this forum. But from science to society is where we bring this kind of support for discussion. Again, we are not implementing. But what was asked also by the International Working Group expert, and some are coming from business companies like Nutriset or Veolia, others from NGO, foundations, it was asked to be more in the operational side, and everyone expects that. Of course, make it concrete, make it operational. So we are going to launch the OEGH factory in Lyon, and it will be a half day of building together through an application. We will invite experts who wish to a transdisciplinary new project. So this takes time, as you know. I remember when we launched the OEGH Forum, I thought that in 6 months we should be able to publish Declaration OEGH. It took 2 years because, as you know, when we sit around the table, what is health, what is One Health, what is pollution, what is etc. At least we are this community, in addition to other community, for example, like the Pasteur Network community, which is a very strong community, and we do bridges and not pretending, we support this effort because we cannot implement. So, for example, it's true that Pasteur Network have a strong capacity of implementation and may have an interest to hear what is said by the civil society also, not only research, and the understanding. One of the main reasons was also due to the pandemic, to the fact that we have seen, a big difference between the state recommendation and the citizens not understanding the value of vaccine and many other subjects. So we try also to create these spaces for that. This is why I was mentioning at the City Hall of Lyon, we will start by this citizen professional, and then it will be the scientific conference, and then the recommendation coming from the International OEGH conference, because it was the case in 2023. We had previous international conference because we do not pretend to have the truth. It was organized by Fiocruz in Brazil, by Ghana Africa in Senegal, University Saint Joseph in Lebanon, and Friendship, an NGO in Bangladesh, and we have also China, India. So this is a movement of discussion, and it's true, Noel, that there is a social aspect and of what we are doing.
Thank you.
Thank you, Noel, for your question. Sophia, you have raised your hand. Go ahead.
Hi, firstly, thank you so much for organizing this. This is very interesting. When you showed as a map of all the representation of the working groups, I noticed that there's not much yet in Southeast Asia. Is this because of lack of interest, lack of experts, or that's my first question. Is that something that you're looking for and you're looking to expand to? And then the second question would be, for these working groups, you mentioned that there are experts that are part of this. What is required in terms of people who may want to be part of this group? Are these sort of spots reserved for, I don't know, sort of senior scientists, or is there also room for early scientist or early career scientist. Thank you.
Sophia, do you mind if you just introduce yourself very quickly from where you're
hi.
working?
Yes. My name is Sophia Perez, and I am from Institut Pasteur Cambodge. And I'm from the Philippines, but I kind of grew up all across Southeast Asia. That's why I sort of noticed this in your presentation, and I am the research program manager for the virology unit here. Thank you.
Thanks.
Let me try to address that, Sophia, if I may. The international working groups are international. We would very much welcome not only Southeast Asia, but also other parts of Latin America, Caribbean, Africa, Antarctica, if that were possible, certainly to participate. So there's no application per se that process that's to be vetted. What we would like is that if you participate in an international working group, that you're active in that. And they meet once a month, once every 2 months. They correspond. The leadership are the co-chairs. I don't like to use the word expert. I think we should all keep an open mind and recognize that we may have a specialty, but that we have to keep an open mind and learn from others. And I think that is the environment that we want to create in this forum. So we would like to have many disciplines in each of the international working groups, and not just virologists or research centers or such as yourself. We would like to have economists, anthropologists, legislators, veterinarians, physicians, public health, food safety, nutritionists that are participating in the different international working groups. And we do welcome those young professionals to join the International Working Group 8, which is just called the Next Generation, where they can talk about some of the issues that they see. But we want that those members that are in International Working Group 8 also participate in another international working group, whether it is on humanitarian, One Health and humanitarian settings, or urban settings, or in education and communication, pollution, access to health services, so that they can participate with the quote-unquote elders. But certainly, I think there's no a limit on our vetting process if you wish to join an international working group. We want to be sure that it represents concepts of sustainability, concepts of operationalization, and tailored approaches to the culture or the environment in which a policy, a brief is being written, or a project proposal is being written. Thank you for the question.
Thank you so much for that. That's great. Thanks.
Thank you, Sophia, for the question, and thank you, Juan, for answering it. Maybe we can take a last question before we close the seminar. Is there any question? You have a question, Brian, but you're not allowed to ask questions.
Oh, wow, darn. It's a question for you, for the Pasteur. I heard from one person who knows Benoit saying, well, this is very interesting. I heard another person who doesn't know Benoit saying this is interesting. But my question is, do you perceive that there is indeed this synergy that we perceive from our viewpoint? And I'm throwing that out there, and because for us it's important to have your opinion in this regard. You don't have to necessarily answer now, but when you give your feedback to Hichem, it would be nice to have that perception on your part. And any suggestions, comments you'd like to give, we are open to listen. I won't say we'll do anything, but we're definitely open to listen. Thank you.
Thanks a lot. Thanks. I think it's quite obvious, Brian, that we have a lot of synergies between our two networks. So Now, and actually, the Pasteur Network is already involved, and many members of the Pasteur Network are involved in your activities. So maybe there is a way now to involve a little more OSH in our activity. So maybe a common event could be organized. We'll see. And actually, we should be able to contribute to your event in Lyon. And I have a little question on that. Are you going to record some of your scientific conference? Because for the people who wouldn't be able to attend, but of course who are interested by your approach, that would be great to share it. I will be happy to share it broadly within the network.
Yes, definitely. We will give the priority for online connection in order to avoid traveling to Lyon, by the way. But we expect about 300 to 500 expert professionals, especially due to the effect also of the presidential One Health Summit that should be the same day, now moving from November 3rd to November 4th. But yes, it will be the occasion and it will be free online because what we are doing is under the umbrella of Pasteur Institute. So it means that it's general interest, public interest. It's not, we are not a private agency, you know. What we do is because we are convinced that it's needed to enlarge the view of what is health, One Health, etc. So it is open, and you can, for those who are not already in touch with us, you can refer to, for example, Cecilia in the Pasteur Network team. Cecilia knows very well and follow every week what we are doing in agreement with Rebecca. And so sending your email, and we can put it in the in your database and to be informed of newsletter information and be connected, of course. This would be possible.
Okay. Great. Thank you so much.
Thank you for the invitation, and thank you for all of you who are supporting us and giving us advices, since the beginning. We need you to stay on board. Thank you.
Thank you, Benoit. Thank you, Juan, and thank you, Brian, for your time and for this presentation. So this is the end of the season. We see each other in 2 months. Enjoy your summer. Enjoy your holidays if you're taking holidays. And please take 5 minutes, only 5 minutes, to fill in the survey, to do the survey. I only have few people answering it, so that would be really nice to have some answer from you, so we can work on the next year program. Thank you very much, and see you in September. Bye, everyone.
Bye-bye.
Thank you.
Thank you.